Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Mrs. Thompson. I see you've scheduled today's appointment due to concerns about a ringing sensation in your ears, commonly referred to as tinnitus. Is this correct?
Yes, doctor. It's been quite bothersome and persistent. It's making concentration extremely difficult and is affecting my daily life and work.
I understand how disruptive tinnitus can be. To address your concern effectively, I need to gather a detailed medical history related to this issue.
All right, what would you like to know?
Let's start with when you first noticed the ringing sound in your ears.
I think it started around 3 months ago. It was subtle at first, but it seems to have gotten louder over time.
Is the ringing sound consistent, or do you experience periods where it stops? And do you hear it in one or both ears?
It's mostly in my right ear, and it's almost always there, but there are times when it seems less noticeable.
Have you been exposed to any loud noises or music, or experienced any head injuries or ear infections recently?
No, I can't recall any specific noise exposure or any head injuries or infections.
I see. Are you currently experiencing any hearing loss, dizziness, or balance problems along with the ringing?
I haven't noticed any hearing loss or balance issues, but there have been a few instances where I felt slightly dizzy.
Do you have any medical conditions, such as high blood pressure or diabetes? And are you on any medication currently?
I have been diagnosed with hypertension, and I'm taking medication for it.
Managing underlying conditions can sometimes help in managing tinnitus. Have you been exposed to any stressors recently, or has there been a significant change in your life?
Well, work has been rather stressful lately, and I've been losing sleep over it.
Stress and lack of sleep can indeed exacerbate tinnitus. Let's conduct a few investigations, including an audiogram to assess your hearing levels, and we may also look into some imaging studies to rule out any structural abnormalities.
What can be done to manage the ringing in the meantime?
We can consider a few management strategies, such as cognitive behavioral therapy to help you cope with the tinnitus, and sound therapy to mask the ringing sound might also be beneficial. Additionally, managing stress and maintaining good sleep hygiene can help in reducing the severity of the tinnitus.
That sounds helpful. I'm willing to try anything that could offer some relief at this point.
We'll try our best to find the most suitable management plan for you. Meanwhile, avoiding exposure to loud noises and managing your blood pressure and stress levels effectively can also help in reducing the symptoms. And of course, we'll also explore other treatment options based on the results of the investigations.
Thank you, doctor. I hope we can find a solution soon. The ringing is really impacting my quality of life.
I understand, Mrs. Thompson, and I assure you we'll work closely to address this issue promptly and effectively.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Doctor.
Good afternoon, Mr. Matthews. How can I assist you today?
I've come here because of consistent pain in my shoulder. It's been bothering me for a few weeks now. My physician referred me to get it evaluated.
I see. Can you tell me more about the nature of the pain? Is it sharp, dull, constant, intermittent?
It's more of a dull ache, and it seems constant, particularly bothersome when I move my arm.
All right. How old are you, Mr. Matthews?
I am 47 years old.
Do you have any chronic conditions like diabetes or hypertension?
No, I don't have any such conditions.
Are you on any medication currently?
Just the occasional pain relievers for the shoulder pain.
Have you had any previous surgeries or injuries to that area?
No surgeries, but I did have a minor fall around a month ago, though it didn't seem serious at the time.
Noted. Any allergies to medications?
None that I know of.
And do you smoke or consume alcohol?
I drink occasionally, but I don't smoke.
Any family history of musculoskeletal disorders or autoimmune diseases?
My mother has rheumatoid arthritis.
Do you experience any redness, swelling, or warmth around the affected shoulder?
Yes, it does seem a bit swollen and feels warm to the touch.
Given your symptoms and history, it seems like it could be bursitis, an inflammation of the bursa, a small fluid-filled sac that reduces friction between the bones and surrounding soft tissues. However, we would need to conduct some tests to confirm this. I'd recommend an ultrasound to check for any fluid accumulation or abnormalities in the bursa. Additionally, blood tests may be necessary to rule out any infections or other underlying conditions.
All right, doctor. Please go on with the recommended tests.
Great. Once the inflammation is confirmed, we can proceed with the suitable treatment. This can range from anti-inflammatory medications and physical therapy to possibly a corticosteroid injection to reduce inflammation and pain. Resting the affected area and avoiding strenuous activities will also be crucial. In severe cases, surgery might be needed, but we will cross that bridge if we get there.
I understand. I'm willing to follow through with the recommendations to get this resolved.
Excellent. Please make sure to follow the prescribed treatment and any lifestyle modifications diligently. Avoid any activities that might aggravate the condition and follow up regularly so we can monitor your progress.
Thank you, doctor. I'll ensure to follow your advice and recommendations closely.
You're welcome, Mr. Matthews. Let's proceed with scheduling the tests, and we'll discuss the findings and appropriate treatment once we have the results. If the pain becomes unbearable before our next meeting, please don't hesitate to contact me or seek immediate medical attention.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Speaking of the risks associated with routine checkups and screenings, they are substantially lower than the ones posed by emergency interventions. It is in the domain of emergency medicine where we can significantly impact by lowering the risks and enhancing patient outcomes. Currently, our mortality rates in emergency interventions are impressively lower than the national average, resting at 6% as opposed to the 11% national average. Most of the emergency cases I encounter involve senior patients who are inherently more vulnerable. The preparation time for such surgeries is minimal, often just an hour or so. Every moment is crucial in preparing these patients, who often have multiple underlying conditions, to prevent any postoperative complications.
Now look at question 26.
How are you holding up, Miss Taylor?
Feeling quite drained. The pain medication seems to be doing its job. I can't feel any pain in my hip, as you mentioned.
It's normal to feel tired after surgery. The procedure went smoothly. We managed to replace the damaged part of your hip joint. You are ready to be discharged.
That's good to hear. I've had surgery on my other hip a few years back, so I'm somewhat familiar with the process. It still amazes me how you can have surgery and be discharged the same day.
You'll need assistance for a couple of weeks, but you should be moving around comfortably in about 6 weeks. However, please avoid any strenuous activities for at least 6 months.
6 months? Last time I started doing light exercises within 6 weeks, but perhaps that was too soon. I did experience discomfort for several months afterward.
Listening to your body is crucial. If you experience pain, it's a signal to slow down.
Now look at question 27.
Excuse me, could I arrange for an emergency checkup, please?
Certainly. May I know the name of your regular physician? Is it something severe? Are you feeling unwell?
Yes, it's about the medication Dr. Stevens prescribed last time. I've been feeling dizzy ever since I started taking it.
I'm sorry, but Dr. Stevens is not available today. However, his associate Dr. Smith has an available appointment this afternoon.
That should be fine. But does that mean Dr. Stevens can see me tomorrow?
Yes, you can see him first thing in the morning. Can you manage until then?
I'm managing by lying down mostly and drinking lots of water. It's just I'm worried the medication might be causing some adverse effects, so it would be best if Dr. Stevens could assess the situation.
Understood. We'll schedule you for tomorrow morning with Dr. Stevens.
Now look at question 28.
All right, everyone must have received the memo regarding the new protocol for patient discharge. I'm sure you all have thoughts on how it will affect your workflow. It is well documented that a well-structured discharge plan significantly reduces the rate of readmission. This is not up for debate. The real task is implementing it smoothly. I understand that everyone is stretched thin. The last thing anyone needs is more paperwork and procedures to follow. However, we've streamlined the process to ensure minimal disruption. Patients and their families will receive clear instructions and what's expected of them post-discharge. And rest assured, the management will be overseeing the situation closely to ensure a smooth transition.
Now look at question 29.
Mr. Anderson seems somewhat disoriented after his knee replacement surgery. When will he be transferred to his room?
I'm about to request transport. He should be moved within the next 15 minutes.
Good. I have recommended some additional post-operative exams. His knee was severely damaged and we needed to reconstruct the ligaments. I am concerned about potential post-op infections, so I'd like him monitored for any signs of redness, swelling, and excessive pain around the wound site.
Understood. I'll ensure the instructions are communicated and that we keep a close eye for any signs of infection.
Great. Let me know immediately if there are any complications.
Now look at question 30.
Today we have Mr. Thompson joining us. He is 3 weeks post-op after his lumbar decompression surgery for spinal stenosis. This is his first day in physical therapy post-surgery, right?
That's right.
For today's session, we plan to start with gentle stretching exercises to help relieve tension in his lower back. We'll gradually progress through a tailored set of exercises aimed at strengthening his core and improving his posture. It's crucial we monitor his progression closely and adapt the treatment to his needs and responses, ensuring a faster and more efficient recovery.
Absolutely. Movement and structured exercise are pivotal for his rehabilitation. By following this regimen, we aim to alleviate his pain and help him regain his mobility and return to his day-to-day activities without discomfort.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today we are joined by Dr. Sarah Hopkins, a renowned expert in infectious diseases, specifically focusing on smallpox, a virus that has had a significant impact on human history, but is now eradicated. Dr. Hopkins, smallpox has been declared eradicated since 1980. Can you provide a little background on how the disease impacted societies before its eradication?
Certainly. Smallpox had been a scourge for centuries, causing massive outbreaks with high mortality rates and leaving survivors with extensive scarring. Societies across the globe had to cope with the devastating and disruptive effects of smallpox epidemics. It had profound impacts not just on individual health, but on the course of histories and civilizations. Several monarchs and prominent figures fell victim to it, reshaping the destinies of their respective nations.
So, the process of eradicating such a virulent disease must have involved considerable challenges and breakthroughs. Can you explain how this extraordinary feat was achieved?
Absolutely, the eradication of smallpox is indeed one of the monumental achievements in the field of public health. The success can be primarily attributed to the development of an effective vaccine by Edward Jenner in 1796 and subsequent worldwide vaccination programs. The World Health Organization launched an intensified plan in 1967, aiming at global eradication through mass vaccination campaigns, surveillance, and containment of outbreaks. It involved meticulous planning, international cooperation, and relentless effort from healthcare workers globally.
The eradication of smallpox must have involved some particularly challenging scenarios, especially in remote or conflict-ridden areas. How were such challenges addressed?
Indeed, reaching remote, inaccessible, or war-torn regions posed significant logistical and diplomatic obstacles. However, there was a unique solidarity and commitment among nations and organizations to eradicate smallpox. Diplomatic negotiations and truces were arranged in conflict zones to allow vaccination teams access. The use of the ring vaccination strategy, which focused on vaccinating people in and around the area of an outbreak, helped in effectively containing the virus, even in challenging conditions.
Given that smallpox has been eradicated, is there still ongoing research or any concerns related to the virus today?
Yes, although smallpox has been eradicated, the virus still poses potential risks, primarily due to concerns over its use as a biological weapon. Consequently, extensive research continues to develop antiviral agents, and there are advanced plans in place to deal with any potential outbreak, however unlikely it may be. Additionally, studying smallpox and the mechanisms of its eradication provides invaluable insights for addressing other infectious diseases and pandemics.
Could the smallpox eradication model serve as a blueprint for addressing current and future pandemics or major disease outbreaks?
Absolutely. The principles and strategies employed during the smallpox eradication, such as international collaboration, robust surveillance, mass vaccination, and public engagement, are universally applicable to controlling other infectious diseases. It serves as a reminder of what can be achieved with global solidarity and commitment. The lessons learned from smallpox eradication are being applied in the ongoing efforts to control and eliminate other infectious diseases, such as polio and malaria.
And finally, the World Health Organization has strict controls over the remaining samples of the smallpox virus. Can you elaborate on the importance of these controls?
The remaining stocks of live variola virus, the virus that causes smallpox, are held in high-security laboratories in the United States and Russia. There is an ongoing debate about whether to destroy these last samples. Some argue that retaining them is essential for developing new vaccines and antiviral drugs, while others advocate for their destruction to eliminate the risk of accidental release or potential misuse. The strict controls and intense debate surrounding these remaining samples underscore the global commitment to preventing any resurgence of this devastating disease.
Dr. Sarah Hopkins, thank you very much for sharing your knowledge and insights on the remarkable journey to smallpox eradication and its lasting impact on global public health.
Thank you for having me. It's crucial that we continue to remember the lessons from our battle with smallpox and apply them in our ongoing pursuit to control and eradicate other infectious diseases.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name's Dr. John Thompson. I'm a dermatologist specializing in skin cancers, and today I'm going to discuss a severe form of skin cancer known as melanoma. Melanoma is a malignant tumor of melanocytes, which are the cells responsible for producing the pigment melanin that gives color to our skin, hair, and eyes. It's one of the most aggressive forms of skin cancer, and if not detected early, can spread to other parts of the body, making it potentially fatal. Melanoma is categorized into different stages, ranging from stage 0 in situ to stage 4 metastasized. The primary cause of melanoma is believed to be ultraviolet radiation from excessive exposure to the sun or from artificial sources like tanning beds. Individuals with fair skin, light eyes, a history of sunburn, or a family history of melanoma are particularly at risk. Allow me to share a case. I had a 35-year-old patient named Mark who came to me with an irregular mole on his back. The mole had irregular borders, varied colors, and was evolving in size. After a detailed skin examination and a biopsy, it was confirmed to be a stage 1 melanoma. Fortunately, we were able to surgically remove the tumor early, minimizing the risk of metastasis. Early detection is crucial in managing melanoma. People are advised to follow the ABCD guideline when examining their moles or spots: asymmetry, border irregularity, color variability, diameter bigger than a pencil eraser, and evolving in size, shape, or color. Treatment of melanoma primarily depends on the stage of the disease. For early stages, surgical removal is often sufficient, but advanced stages might necessitate a combination of surgery, chemotherapy, immunotherapy, and targeted therapy. Patients are also advised to practice sun safety, regularly apply sunscreen, and avoid tanning beds to reduce the risk of melanoma. The emotional and psychological impact of a melanoma diagnosis can be overwhelming for the patients and their families. It's imperative that healthcare professionals address the concerns and emotional well-being of the patient, providing support and counseling as needed. I remember treating a young woman, Lisa, who was diagnosed with stage 3 melanoma. She and her family were understandably distressed. We provided psychological support and involved her family in discussions about treatment options, including participation in clinical trials for new therapies. Now, talking about prevention and lifestyle, some patients wonder about the role of diet in melanoma risk. While there isn't conclusive evidence that a specific diet can prevent melanoma, a healthy, balanced diet rich in antioxidants found in fruits and vegetables may help in reducing the risk of several cancers, including melanoma. Regular physical activity and maintaining a healthy weight are also beneficial. In conclusion, melanoma is a serious form of skin cancer that requires immediate attention and management. Early detection, protective measures against UV radiation, maintaining a healthy lifestyle, and regular skin checkups play crucial roles in managing and preventing the progression of this disease. It's not just about the physical treatment, but also addressing the psychological aspects and providing comprehensive support to the patients and their families. Always be sun safe and be aware of any changes in your skin. Regular self-examinations and dermatology checkups can be life-saving. If you have any concerns about unusual moles or spots on your skin, please consult a dermatologist immediately.